Welcome to our podcast, Ride and Rebuild. Dr. Arroyo, Dr. Estrada here. Today we're going to talk about one of the most common knee injuries in mountain bikers. In this case, we're going to talk about patellofemoral pain syndrome.
All right, so Dr. Arroyo, what is patellofemoral pain syndrome?
So patellofemoral pain syndrome is, like I said, one of the most common injuries in mountain bikers. For most part, it can be related to any anatomical variant, pre-existing injuries, or even overuse. In this case, in mountain bikers, it's mostly related to a poor bike fit and also poor technique when mountain biking. Also, it can be to overtraining or over-constrain of the knee joint. All right, guys, so when we have patellofemoral pain syndrome, pretty much what is happening, and I'm going to show in this model, this is the femur, this is your leg bone or your tibia, and you have the joint, and the cartilage is this lining that delineates both the femur, tibia, and your kneecap. So what happens over time is we are creating over constraint of this joint, either by poor biking technique or any poor bike fitting. And what happens over time with the over constraint and the friction, we can start creating damage like we're seeing here in different areas, both your kneecap and your femur area. And over time, some of these injuries might require a surgical procedure. So what we're trying to do here with this bike modification and bike fit is to prevent these injuries at long term. And I think most of these injuries can actually be fixed by good bike fit and good technique when mountain biking. So now I'm gonna let you guys with Dr. Estrada, who's gonna explain to us how he's been treating one of his patients for patellofemoral pain syndrome.
All right, guys, so let's bring in Carlos. So we got Carlos. He's an avid mountain biker. He's been riding for years. He's got this fancy, nice new bike here, but he can't ride it. What's been going on, Carlos? You let us know.
Hi everyone, I'm Carlos. I've been avid mountain biker. In the past 6 months, I've been dealing with a lateral knee pain that's typically happening when I'm going uphill in the mountain bike, also in the road bike.
Hey, Dr. Estrada, can you explain to us what you've been doing to treat his knee pain?
Yeah, it's been a work in progress for sure. So definitely, Carlos has got what I see a lot in the clinic, guys. Hamstrings are tight, the glutes are tight, everything's real tightened up from riding so much. And so we've definitely been working on stretching, getting things loosened up to get a little more balance when he's been riding. Now when it comes to his bike, we brought him out today to say, okay, let's take a look to see how things are moving on the bike now. Now he definitely has some modification that he's done to his bike. He initially got a bike fit professionally done at one of the local bike shops, but he's made some modifications, and even those slight modifications can have a big impact on what's happening in the knee. And so he's actually gone clipless today. He's not using any clips, riding a little bit more. And probably the big thing that we're seeing today is also his performance on the bike. So giving him some little tips like increasing his cadence when he's climbing, focus on alignment while you're climbing, and just working on more of a zone 2 kind of training intensity is the goal. So Carlos, how's it been feeling today after the ride?
Today, at this moment right now, it feels fine. I felt it a little bit on the climbs. From pain levels from 1 to 10, it's like a 2, 3, so it's manageable, it's doable. So I'm able to ride. At least I was able to complete this ride.
And so for the first ride back, sounds good. All right, hey, Dr. Arroyo, so what do you think? What's the suggestions? Where should we go?
Well, right now I think Dr. Estrada is doing the right thing. He's just modifying our patient's technique on how to ride his bike, changing the cadence. It just requires most likely more strengthening of his quad. Maybe he has some quad hamstring imbalance. So working on that like we're doing right now, I think it's gonna fix his problem. Like I said, eventually what can happen if we don't fix the problem, we can start having injury to the cartilage, which eventually can lead to surgery. So that's what we're trying to avoid here with our patient.
And so stay tuned, guys. Next episode, we'll talk a little bit about PRP. How can it help?
There you go. Stay tuned. Ride and Rebuild.